without that availability for health care under the Affordable Care Act. Now, the change in eligibility goes into effect September 1st, so dreamers will have to find another way to get coverage, like San Francisco's Health ESF. Other communities have something similar. But those who cannot get coverage that way or under their employer, they're likely to go without care, experts say, incur high out-of-pocket costs, and perhaps end up in emergency rooms for care.
Well, dreamers, people who were brought to the U.S. undocumented by their parents, are about to lose a critical safety net.
The Trump administration is making them ineligible for health care under the Affordable Care Act. Today in the Bay's Chris Sanchez joins us with the impact on those DACA recipients and their communities as well. Chris?
Well, good morning to you, Marcus and Laura. So there are about 2,300 DACA recipients or dreamers who have health care under the Affordable Care Act. So it's not all dreamers, but as people in their late 20s and early 30s, they likely have spouses and children who will lose their health care as well. That includes people like 32-year-old Reina Maldonado, whose parents brought her to the U.S. at the age of 6, undocumented. As she and her family run their Oakland restaurant, they're also scrambling to figure out what's next without that availability for health care under the Affordable Care Act. The change in eligibility goes into effect September 1st, so dreamers will have to find another way to get coverage, like San Francisco's Health ESF. Other communities have something similar. But those who cannot get coverage that way or under their employer, they're likely to go without care, experts say, incur high out-of-pocket costs, and perhaps end up in emergency rooms for care. A University of San Francisco law professor says this will have an impact on the overall health of the community, and it could signal greater instability ahead for entire families like Reina's, as the Trump administration no longer deems them lawfully present.
It's an indication of a chipping away at DACA status, and immigrant rights advocates were hoping for the opposite. They were hoping that this is one group that the president was sympathetic toward because they've lived here so long and they've been working.
We contribute so much to this country outside of our labor, and it's time to take care of each other.
Now, this is health care that they would be paying for, but according to the most recent DACA survey, 92% of dreamers were employed, and the majority found jobs with better pay and health care benefits after they received DACA protection. Almost half said that if they lost that protection, they would be less likely to report employment abuse like wage theft. That's according to a survey of more than 400 dreamers across the country by the Center for American Progress, a nonpartisan policy institute. Marcus and Laura, there are, again, about 2,300 people who will be impacted by this. The concern is that these rollbacks of ACA coverage for dreamers could ultimately affect other people like refugees and asylum seekers. Back to you.